Hi, everyone, and welcome back to the Doctor Interested podcast, where we explore topics related to health, medicine, and wellness. I'm your host, Madison Wu, and today we're diving into a topic that's incredibly close to home for me: eye health. Vision is something most of us take for granted, but behind every clear image we see, we are specialists who keep our eyes healthy, from prescribing glasses to performing surgeries. I'm excited to be joined by Dr. Wu, an experienced optometrist who's been in the field for over 2 decades and is passionate about both clinical practice and education. Thank you for joining us today. Can you tell us a bit about yourself and what drew you to the field of optometry?
Um, a little bit about myself. I currently work in a private office in Alhambra. Um, what drew me to optometry was when I was 17, I had a retinal detachment, an expected retinal detachment, and I was in and out of optometrist, ophthalmologist, um, quite a bit. So I just kind of drew me into what they did, and I looked like, it's something that I would enjoy doing.
Thank you for that. Before we dive deeper, let's define the difference between optometrists and ophthalmologists, something that even I used to mix up. Optometrists are primary eye care providers who conduct eye exams, prescribe glasses and contacts, and diagnose basic eye conditions. Ophthalmologists are medical doctors who can treat more advanced eye diseases and perform surgeries. Today, we'll be discussing what these roles look like in real life and what makes this field rewarding and how eye health connects to overall health. So let's jump into our first question. What does a typical day look like for you as an optometrist?
Because I work in a very retail-oriented office location in a strip mall, a typical day is very routine for me. Um, Patients come in needing glasses or contacts, and I do a refraction and basically just, fit them with contacts or glasses. Occasionally, I will get some eye disease. Eye, eye disease that I need to treat. Um, but I practice in a very narrow field of optometry. I have colleagues that practice in the medical offices, in hospitals. They practice with ophthalmologists as a large group. Those optom or in teaching institutions, those optometrists they do quite a bit more than what I do. They diagnose and treat glaucoma, macular degeneration, and any kind of corneal disease, anything that doesn't require surgery. In most states, optometrists are able to treat. Um, already. It's the only difference, to clarify, between an optometrist and ophthalmologist. The main difference is doing surgical procedures, because the field of optometry have come a long way in the past several decades.
Yeah, thanks for that response. What's one thing people usually misunderstand about eye health or what you do as an eye care professional?
Like you said, eye health, a lot of people take it for granted until something happens. It's important to get your annual check or at least every 2 years because we can detect high blood pressure, cholesterol, diabetes in the eye if it's not, controlled. And those macular degeneration, cataracts, and those things are a lot more treatable when it's diagnosed early. And a lot of those things are asymptomatic. Um, Diseases in our body, oftentimes we will feel pain, because our retina inside the eye has no sensory nerves, there's no pain. So people are asymptomatic with a lot of the eye diseases. So it's important to get a routine check on a regular basis.
Thank you. Can you tell us about a particularly memorable or meaningful case you've worked on, something that stuck with you?
Yes, I had this patient come in, a 45-year-old dad, Korean descent. He said all of a sudden he was not able to see very well for some reason, even with his glasses on. It was a very sudden, like yesterday it happened. And I basically looked in his eyes, I dilated his eyes, and I found that he had a major retinal detachment that just happened. Retinal detachments are considered emergency. If treated early enough, you can save your vision. If you do not treat it early enough, immediately, you can permanently lose your vision because once the retina is completely torn from the choroid, you can't really attach it back on. So, anyways, so it was a memorable case because when I saw the retinal detachment, he was from Kaiser, his insurance. So I had to tell him he needs to go to Kaiser emergency room, and basically I had to write him a very strong report to show the emergency room that he needs to see an ophthalmologist right away. Because oftentimes, if you have a typical eye, if you go into emergency room with some kind of eye complaint, emergency room doctors are generally, general practice doctors. They're not very versed in telling what's important to refer or call the ophthalmologist and what is not. So sometimes retinal detachment can go without being consulted with the ophthalmologist. But anyways, so the good news is he had surgery, came back and thanked me for saving his eyesight. And he is now a permanent patient of mine. He comes here with his entire family every year. So that was a very memorable case. He reminds me every time he sees me, "Oh, Dr. Wu, you saved my vision." So, but that's great.
Yeah, that's great. What advice would you give to students or young people who are interested in healthcare, whether it's optometry, nursing, or another path?
Most important thing with students, they tend to not consider the future of whatever path or career they're thinking about. They tend to feel like, oh, my friends are doing pharmacy, my friends are doing optometry, my friends are doing nursing. I'm just gonna do it, because, you know, it just sounds, like something to do. But um, one thing I learned after graduating is optometry got saturated with a lot of optometrists, and pharmacy got saturated with a lot of pharmacists. So jobs are not easy to find um, in pharmacy anymore, as during the past decade or so. So students interested in certain field, they need to do some research. They need to look at the forecast, the future down the line, 5 years down the line, will this field and this profession still be in need? They have to look at the jobs that are being posted on job sites, see if there's a lot of jobs available, and they need to also not just consider the income, but also um, consider um, oh, I lost my thought. They need to also consider um, how many schools? How many schools? Because right now, on there's a lot of PA schools that are opening up, physician's assistants, and NP schools are opening up. So there's gonna probably be a large saturation of NPs and PAs coming out. So that's a concern for people that are gonna be going into that field. And a lot of students do not look beyond what's next year. So I think it's important they need to look
Yeah.
beyond that.
Okay. Thank you so much for that response. Wow, I learned so much from today's conversation, and I hope you did too. We talked about the difference between optometrists and ophthalmologists, the importance of early eye exams, and how eye care can reveal a lot about your overall health. Personally, as someone interested in the medical field, hearing about how interconnected the different fields of medicine were are really inspiring. Thank you again for Dr. Wu for sharing your time and insight. That brings us to the end of this Doctor Interested episode. We hope you enjoyed learning about eye health and the people who help protect our vision.